So it's almost time to start of engineering workshop 2. So please turn on your camera and wait. Hi, this is Kuriko. I'm the engineer of Temdec, and thank you very much for participating and supporting nice events in APAN53. So this is the final session for our medical working group, that is engineering workshop 2. Before starting, I'd like to invite greetings from all participants one by one. So first is Shunta-san, Temdec.
Hello everyone, I'm Shunta Toimatsu from Temdec Kyushu University Hospital. Nice to see you.
And Dr. Dimple from Punjabi University, India.
Yeah, hello everyone, good evening. I'm from Department of Pharmaceutical Sciences and Drug Research, Punjab University, Patiala.
Okay, Dr. Dimple will make presentation in special lecture. And next is Mr. Rojan from Kathmandu Model Hospital, Nepal.
Hello everyone, nice to see you again. And I'm Rojan Sai from Kathmandu Model Hospital. Thank you.
Thank you, Rojan. And next is Miss Premira and Mr. Dinesh in Sankara Nesralaya in India.
Hello everyone, this is Pramila.
Hi.
Dinesh.
Hello, this is Dinesh.
From Shaka Netralaya, Chennai.
Thank you very much. And next is Mrs. Yukiko Hisada, Temdec.
Hello everyone. I'm from Temdec, Kyushu University Hospital. See you later.
And I can see Mr. Shin, Temdec.
Hello everyone, this is Shintaro from Temdec. Looking forward to your discussion. Thank you.
Thank you. And Miss Miho from Temdec.
Hello everyone, this is Miho as a coordinator of Temdec.
Okay, and Yoshiko from Temdec.
Nice to see you all and nice to see you again. This is Yoshiko from Temdec.
Thank you. And Mr. Rico from University of Airlangga, Indonesia.
Hello everyone, I'm Rico Yanori from Universitas Airlangga, Indonesia. Nice to see you all.
Thank you very much for your joining. And I can see Mori Yumi from Temdec.
Hello everyone, and I'm joining the working shop, and I'm just counting the people who are joined and who are not joined. Okay. Thank you.
Yeah, thank you. And Chen-san, Taiwan National Taiwan
Hi.
Society of Telemedicine.
Okay, I the Taiwan Heart Foundation or Taiwan University Hospital. Nice to see you all, and looking forward to today's exciting sharing. Thank you.
Thank you again. And Min-san, Vinaren, Vietnam. You're muted. Could you turn on?
Okay. Hello, everyone.
Hi.
Hi, my name is Minh from Vinaren, Vietnam. Nice to meet you all.
Thank you. So now the participant is, maybe the all participant is made greetings, and I hope the another member will come soon in the meeting. And let me show the today's program of second workshop. So in the second workshop, first we will have the special lecture from Dr. Dimple. The title is Role of Artificial Intelligence in Medicine. And then we will have the session review, dental, teleophthalmology, etc. one by one. And then they have the discussion. Okay, then I'd like to invite the first presentation from Dr. Dimple from Punjabi University, India. So please, Dr. Dimple.
Thank you, Kuriko, for nice words. The topic of my discussion is a role of artificial intelligence in healthcare.
Sorry, Dr. Dimple. I think now you are using two laptops.
Yes.
And I think it's better to mute the speaker of one laptop because your audio is now looping.
Okay. Is it fine now?
Yes.
So my topic of discussion is artificial intelligence in healthcare. Although in various sessions of TEMDEC, like teleophthalmology, teledentistry, we have discussed the use of artificial intelligence in healthcare, but I would like to bring to notice certain points to our engineers on the panel, Shunta and others, and the physicians on the panel. So with my due respect to all, I would like to focus on certain issues raised on artificial intelligence in healthcare. The contents of my slides are a basic introduction to artificial intelligence, recent breakthroughs, biomedical applications, and what are the challenges ahead. Basically, the artificial intelligence is a stream of computer science where you analyze certain complex data and you find meaningful relationship between the input data, which is usually the clinical data, and you make suggestions to the physician. So this is the conventional clinical practice, that you collect the data from the patient. Either it can be certain basic data like gender and all, taking blood pressure, or it can be a diagnostic data like MRI or ECG, and it is submitted to the doctor for his judgment. And the doctor gives the decision on the basis of his prior knowledge, and that is recorded in the electronic health records. Now, it can be supplemented with various support systems, that is conventional decision support system. Here the support system is passive. In this particular case, the support system is active. It is integrated into the decision of the physician, and whatever is the final decision of the physician that is recorded. Now, what we are having is a third generation artificial intelligence where the role of the physician is taken care by machine. Yesterday, there was a session on teleophthalmology, and Dr. Senthil very well pointed out that if you give whole autonomy to the machine or to the robots, something bad or something which is not allowed might happen. So you should always have a physician. That is what is concerned. These are the various areas in which artificial intelligence is doing a lot of work. If you scan the PubMed literature, you will find a lot of data on genetics, on diagnosis, drug discovery, where artificial intelligence is doing wonders. But how to use it rationally so that certain diseases are diagnosed at a very early stage. What all data we have with us, which is the input data to your machine. After all, the machine is going to give you some artificial intelligence. How does a non-living thing has intelligence? That is a point to be pondered upon. The first thing is your MRI images or some diagnostic data, radiological data, which you have in hand. Most of the time, the radiological data is very extensive and the physician does not have time to analyze each and every parameter. So you can take help of artificial intelligence in that case. Genetic expression, certain non-coding RNA, they give you a unaltered genetic expression which is abnormal. That also you can diagnose it very effectively with artificial intelligence. And this is how an artificial intelligence work. Whatever clinical data you have in hand, that goes into the natural language process and that is fed to your computer network in the form of an algorithm, and the machine is trained. It can be a supervised learning or it can be an unsupervised learning or it can be a hybrid of the two. I'll go to that in the few slides afterwards. What are the diseases where you find artificial intelligence really working wonders? One is cancer. It's very, very important to diagnose or to make prediction about the disease at an earlier stage. Then only you can treat the patient and reduce the mortality rate. Then in case of stroke, artificial intelligence is very helpful in diagnosing the patient or making prediction at a very earlier stage. And then cardiovascular and latest data I have found in the ophthalmology. And we had very good session on teleophthalmology and teledentistry. This is how they have evaluated. Although we feel that a doctor should be always there by the side of the patient, but that is not always possible in a rural setting or say in case of a pandemic where you have a lockdown. So what to do in certain cases? If you have machine learning and that also in the form of deep artificial neural network, your cost is also low and productivity is also high. That is what we are aiming at. So these are the areas where clinicians have worked and gathered data on integrating the medical professional, trained medical professional, and the machine, the artificial intelligence. What is machine learning? It's a field of computer science that uses algorithms to identify patterns in the data. When I say supervised learning, that is in the center. This is a cartoon for supervised learning. You have lot of data available, prior data available. So the training set is very, very high. There is one independent variable, X, and there is one dependent variable, Y. You already have in mind that the input variable will be, say, the fundus photography of the retina. And the output variable is diabetic neuropathy or retinopathy. In that case, you have got data from lot of patients that you feed it into the machine. And now you try to predict whether a fresh patient has got diabetic retinopathy or not. That is called supervised learning. You have the relationship in your mind. What is unsupervised learning? You don't have any Y. You don't have any dependent variable in your mind. You are finding out that this huge data I have collected, how many subclusters or subsections it has. That is unsupervised learning, where you use clustering, principal component analysis, such type of algorithms. And now we are having a hybrid semi-supervised learning platform that is coming up in a very good manner. These are the various technical terms which my engineers on the panel might be knowing, but which is most common? The neural network. Training the machine just like the neurons of your brain. But for training, you need a large data set, prior data, prior information on a disease, which was not possible with COVID-19. Although post-COVID, we have a prior information on such pandemic. So we have collected huge data during COVID, and we can analyze it very well using artificial neural network so that we are ready for challenges of future, maybe some other viral disease or other pandemic. God forbid, we should not have it, but we should be prepared for such challenges. Again, the technical knowledge about neural network, and neural network is doing wonder. What is neural network? It's just like the neurons in your brain. You are putting some input data, you are getting some output data, and there is one hidden layer where your brain stores the memory. Same way in the computers, you have such type of networking. So it's a very complex pattern of things. You can have two hidden layers if your correlations are very complicated. So this is called deep learning with two hidden layers. So these two words you must have seen on and on in the literature: artificial intelligence and machine learning. Again, machine learning will be of two types. If you give some data to it, it will be supervised learning. And if you don't give any prior information, then it will be unsupervised learning. This is the graph or the trend line. We are seeing that the deep learning neural network platform, if you see PubMed, if you see various reports in Nature, they are doing wonders. And they are of great help to the physician. So this is what we can do in case of diagnostic studies, electrodiagnosis, like your ECG report. It's not just a peak, it gives you a lot of information. You can predict a disease at a very earlier stage with the help of artificial neural network. Thank you so much. Any question?
Thank you very much, Dr. Dimpu, for your wonderful presentation. So as I I'm not very familiar with AI, but can I make a question?
Yes.
So I understand the deep AI for the study. We needed to prepare the data set of the result and the source, and then the education. And after we make the AI, we finally get the image input and then the result. And
Yes.
as you said, there is a hidden layer between the input and the output, and there may be two hidden layers. So how we can find the hidden layer?
We are having various type of networks. Like one neuron is connected with the other neuron, and there are many combinations possible. So if you have less number of data and your data is less complicated, you have less number of variables, you can have one hidden layer. You're not getting good results or good correlations mathematically. Then how to improve your data? How to improve the prediction power of your data? Include one more hidden layer. But you should always be starting with a minimum one layer. Try with your prior data set. You have already a lot of clinical data in your lab. Why not to use the prediction power of this artificial intelligence? So this is smart healthcare, and this is a very good disruptive tool. Disruptive tool means the whole thing which we used to do conventionally, feeding the data, feeding the electronic medical records, and then the doctors have to sit for the long hours on the machine to evaluate the prediction. Why not this work is done by engineers, right? So APAN53 is a very good platform to discuss the use of artificial intelligence, where we have all researchers from engineering background as well as from clinical background and from university setting. Why? Because our students, they should be trained with this mindset that ultimately you have to conquer such disease, such ailments. Everyone should know little bit of engineering and little bit of medicine. That is what COVID-19 has taught us.
Yeah, thank you very much. I understand well about what you are meaning. And also regarding the hidden layer, maybe the result of AI is not good enough. Then we need to suspect the hidden layer.
Yes.
We need to suspect the hidden layer, and we need to prepare another data, more data for the education.
Yes, and you need to put more computers, like your computing machine has to also be of high standards, IBM and all. It cannot be a simple computer. Supercomputers are required.
I see. Thank you very much.
Yeah, thank you so much.
Any question, comments from anyone? Okay.
Thank you.
Okay, then thank you, Dr. Dimple, for your educational presentation.
Thank you, Temdek, and thank you, the group, for inviting me. Shall I leave? I have a meeting right now. Thank you so much.
Okay, thank you very much. Okay, then the next is session review from each chief engineer. So this time we had the formal part of the engineering workshop. We have some session review. So next is dental telemedicine session from Mr. Rico, Ariranga University. So I think you will be the first time to make presentation in engineering workshop this time. So thank you very much for your supporting dental session, which was before Mr. Tungu supported.
Yes, Kuriko. Thank you for the time. Good afternoon, all, ladies and gentlemen. I'm glad to see you all. Before we start the presentation, let me introduce myself. My name is Riko Januari. I'm from Faculty of Dental Medicine, Universitas Erlangga, Surabaya, Indonesia. Allow me to start. Can you see my presentation, right?
Yes.
Okay. Technical review for dental session on March 9, 2022. This session outline, this topic is the advantage of orthodontic surgery in Asia. Chair is Dr. Yosi Yohanita from Universitas Hasanuddin, and co-chair is Dr. Melissa Diatma, and second co-chair is Dr. Sari Sendi Sumardi. Chief engineer one is myself, Riko Yanari, and second chief engineer is Mr. Tunggu Laksono from Universitas Brawijaya. This connecting institution you can see on my presentation from Universitas Erlangga, Brawijaya University, Universitas Hasanuddin, Universitas Indonesia, Niigata University, Syiah Kuala University, and also Temdek from Japan. This presentation, the speaker of presentation is Muhammad Ruslin from Universitas Hasanuddin. The second presentation is from Dr. Andra Rizkiawan, and third is Universitas Indonesia from Dr. Sari Sendi, and fourth presentation is Niigata University. This is the connection test day before the session. This connection test, all participants can do the good connecting, no problem at all. And here the photo session of the session. This is the dental session, photo documentation by Dr. Roslin, Dr. Sari Sendi, and also Dr. Andra. Here the technical review from all universities is good. Network and audio image all good, not error at all. The session summary, at first there was a speaker from Niigata University, Professor Dr. Kei Tomihara, who will fill the fourth presentation and was replaced by Professor Hiroshi Tomonari, DDS PhD from Surumi University in Japan. But in the end, both speakers canceled to attend, and the session continued with 3 speakers. The number of participants attend at Zoom is approximately 267. This is the conclusion. 3 speakers from Universitas Hasanuddin, Universitas Erlangga, and Universitas Indonesia went well. Both audio and visual were well streamed. All participants attended via Zoom and YouTube because the number of COVID-19, especially Omicron, is still high in some regions. This session also streamed on Dental Medicine Erlangga YouTube channel. Thank you all. Thank you for great attention, ladies and gentlemen. Hope we are always healthy and protected from virus COVID-19. Hopefully this pandemic will be end soon. Thank you.
Thank you, Mr. Rico, for your nice presentation. Any question, comment from anyone for dental? No. So from myself, thank you for your organizing very nice session. Actually, the session was very nicely. All participants using virtual background and very good, smooth, and good presentation, and many participants. So one thing I think that there was some miscommunication about the streaming link, but finally, finally it was no problem. Did you? Is that the first time for you make streaming Zoom to YouTube?
No. I have so many time before in Universitas Erlangga.
I see.
Yes. there's mistake because I think that I will use my Universitas Erlangga Zoom, but Mr. Tunggul said that use the Temdeck Zoom, not our Zoom.
I see. So some the account.
Yes.
Yeah, yeah, login account is sometimes difficult and have some problem of the step. Yeah.
Yes.
Thank you very much. Any question, comments from anyone?
Hello.
Yeah, please.
Hi, I'm Mr. Rico. I just wonder, I'd like to ask about yourself, but are you an IT technician in Airlangga University?
Yes, in Faculty of Dental Medicine, Universitas Erlangga.
Okay. Not the Airlangga University itself, but you belong to the dental faculty.
Yes.
Okay, I understand. Thank you very much.
Thank you, Mr. Sundar.
Thank you. Okay, then thank you very much, Riko-san. And let's go to the next session presentation. And before going that, Shunta post us about the demonstration. So he in the workshop 1, we had the virtual reality demonstration, but it was not interactive. We could streaming out, but not the interactive one. So he set up again. And if you have time, please join. The demonstration of virtual reality workspace will be done in the end of this workshop.
It must be interesting for all of you.
you said. Okay, then the next is I can see okay, I can see new participant from NLAN, Mr. Nirajan. So why don't you say hello to everyone?
Hello everyone. Nice to see you all. Thank you.
Thank you for your participating. And I can see Niraj and Ren. Hi. Thank you.
From Nepal Research Integration Network, and I was participating other event in the APAN, and this session I participated today.
Thank you.
Thank you.
Okay, thank you. Okay, then let's go to the next is the teleophthalmology, Miss Premila from Sankara Nesralaya.
Hello, good evening, everyone. Just sharing my presentation. Is my presentation visible?
Yes.
Technical, our session is teleophthalmology session. Engineers is myself, M. Pramila, and Mr. Dinesh Murthy from Shankar Netralaya, Chennai, Tamil Nadu, India. The session is teleophthalmology session, and our topic is using teleophthalmology to diagnose various ocular eye disease. It was held on 9th March, Wednesday, and the connection method is Zoom. And the presentation material, we have used PPT and video presentation. These are some session photos which we have taken during the session. The connection test day before the session, we had with Aravind Eye Hospital and Aditya Birla Shankar Netralaya, and JIPMER, Rajan Singh Eye Hospital, Wellcare Health System. It was very good. The technical review for the session and the streaming, we got it's a good clarity. The network, there was no network issue. The audio and the video clarity was very good. And for the conclusion, this time we had connected 8 institutes. Next time we will plan for more institutes. The YouTube streaming video and audio clarity was very good. We have started on time and we have ended mostly, this went on well. For 20 people watched the live during the session. Next time we will improve that. Video and audio clarity was very good at all the connecting institutes. Overall, the session went on well without any network issue. Thank you.
Thank you, Premira-san, for a nice presentation.
Thank
Any
you.
question, comments from anyone? You are muted.
Hello, Premira-san. Yeah, this is just a comment. Yeah, I'm in this teleophthalmology session. I'm so surprised. One presenter, Dr. Natarajan, has a video presentation, and then you combine the live presentation and then pre-record presentation. It works very well. So yeah, and thank you for your arranging with all the presenter for careful test sessions. Thank you.
Thank you so much.
Thank you. Any other question, comments? No? Okay, so thank you very much for your successful event.
Thank you.
Thank you.
Okay, then the next is MIS, and chief engineer is Mr. Wirafon from Mahido University Shirira Hospital. But since he have another job, so Ms. Mori will make presentation on behalf of Mr. Wirafon.
Okay, this is my first time to make a presentation. Okay, and let me share the screen first.
You can make it.
Oh yeah, thank you. Thank you, Chief. Okay, and pick up the screen too, right? Okay, and here, can you see? Oh, and hold on.
A lot of words and letters. Oh.
Okay.
Okay.
Is it visible?
Yes.
Okay.
Okay,
Yes,
good. Okay, and I'm gonna talk about the engineering workshop APAN53. That's MIS session, and that slide is made by Mr. Wirapon. I'm just telling there and showing a slide just instead of him. Okay, and he is next slide. Okay, MIS session was held, and yesterday there was a 10th of the March, and they're starting at 12 o'clock, about 90-minute session, and the organizer is Professor Tawachai, and the next one. Okay, here is the list of the connecting institution. Actually connecting just 4 institutions this time, and Shirira Hospital, and I cannot say that word, Bamlanglad International Hospital, and the Prince of the Songor University, and one is from the United States, University of the California, San Francisco Health System. And next slide. Okay, there was the 5 presentation. The most of the first 3 is the presentation from the Shirira Hospital, and the last 2 is presentation from the University of the California. And the schedule is pretty well started about 1 or 2 minutes late, but closing time is just on time. I get that words. Oh, wasn't it? The Miss Kuliko? It wasn't that long, that much. Okay, next slide.
Oh.
That's okay. Okay, and this is slide say there the test schedule of the APAN53 and MIS session. And that was day before the conference they had. And there will be there 2 round open and the test connection. Well, it's kind of the technical things and just telling them the connection things, I guess. Okay, next to the slide. Okay, this is how to connect to the people in the following things, and the Zoom to the participant, and the Zoom to the live streaming, and the streaming goes to the participant by the streaming. And here is the I think the address. I mean connecting information. The one thing I noticed that the streaming address was changed. Changed in the last minute, I guess. And we just put the information and asking the APAN secretariat to change the address of the streaming. Okay, next one.
Yes.
Okay, thanks.
Perfect.
Okay, and there. Well, this is a schedule for the testing. That's day before the session. And the problem, let me read that for you. And on 10th of March 2022, when the seminar had started, there was only one organization facing a technical problem, which was the Prince of the Song University from the Thailand. They had problem on the quality of the video that was not clear and smooth. Later, we had found that the speaker was not presenting from the same place they had on the testing day. Therefore, the cause of the problem suggested to be from the instability of their network system. In order to solve the unexpected problem similar to this, we would like to provide some solutions. The location of the speaker on system testing day and on their seminar day must be the same, or the speaker should send the presentation on file to the venue and present through their assistant instead. Okay, here's a picture of the staff, and the top one is a Virapon, and on the left is, his name is a Tanachai, right?
Yeah.
And on the right side, him, I don't know what his name is. I'm sorry. Thank you very much. And don't ask me any technical question to me. Okay.
Yeah. Thank you very much for your nice presentation.
No, it's not.
Lisa. Very nice. So any question, comments for MIS? No? Actually, the MIS was maybe we have some we worry very much for the preparing, because we don't have update of the program very well. But because they have very skillful staff and coordinator, and in the final week, they worked very well, and many emails and many information, and prepare in the very final week. And yeah, I think there was some problem in the beginning of session, and session start time was late because of solving problem. So probably we need to talk more for next MIS to build upon. Okay, then the maybe no question. So thank you very much, Yumi-san, for MIS presenting. And next is the I can see Ishak is joined. So can we have the, can you make presentation regarding JIPMA session?
Yes, ma'am. Can you hear me?
Yes.
Yeah. Let's open my presentation.
Yeah. Please. We cannot see. So please share your presentation.
I'm just sharing. Give me a minute.
Okay.
Are you able to see my presentation?
It's editing mode. Can you show slideshow?
Is it okay now?
It's reading something. It's taking time for showing.
If I make full screen, it get paused.
Can you share whole display?
Yes, let me try that. Is it okay now?
Yeah. Okay,
so
now.
Can you start now?
Yes,
Can you start
please.
now?
Yes, please.
Yeah, myself, Mohammad Ishaq, technical staff from JIPMAR, India. This is my technical review JIPMAR session, APAN53. Our session outline, APAN53 meeting JIPMAR, we have on Wednesday, 9th March. Dr. Kalayarthan is the organizer. Our topic is the advanced GA surgery. We have used Zoom this time of JIPMAR Zoom Pro account. We have 4 presentations from different hospital. Dr. Kalayarthan is the moderator of this session. He given the opening remarks. The first session from Dr. Rajalingam from Dr. Vela Institute of Medical Center, India. And second presentation by Dr. Kalayarthan, JIPMAR, Puducherry, India. And third presentation from Dr. Rajneesh from Sanjay Gandhi Postgraduate Institute of Medical Science, Lucknow, India. And the fourth presentation by Dr. Vaibhav Kumar, All India Institute of Medical Science, Jodhpur, India. And finally, closing remarks by Dr. Kalayarthan. This is our session photos. There are 4 presenters. Connection test day before the session. We have scheduled 2 testing sessions. Testing session 1 on 7th March and second on 8th March. So no doctor was joined during the testing session because they are very well in the Zoom, they said by phone. So they all directly joined the session. Our technical review. So the first presentation from Dr. Rajesh from Rela Institute of Medical Center, India. Streaming audio quality, everything is good. And second presentation by Dr. Kalayarasan was good. Third presentation by Dr. Rajinish also very good. It's very smooth and audio is clear. And third is Dr. Vaibhav Kumar, also very good. New institute was joined, Andhra Medical College this time joined through Zoom. And our technical issue is at the beginning, as we planned, host control given to Temtech to start streaming in YouTube. Unfortunately, delayed due to some technical issue, then rectified after session start in 3 minutes. Conclusion. All presentation went well without any major issues. Engineers from all the centers are supported very well. We would like to add more centers in future APAN sessions. Thank you.
Thank you, Ishak, for your nice presentation and also supporting JIPMA. And any question, comments from anyone?
May I add the review, technical review from Temtech side? Yeah, as Ishak mentioned, we had a problem when we started to streaming out or to YouTube. That's because of the account, the login problem. We tried to pass the Zoom login information of the JIPMA Zoom account, but we tried here in Japan, but maybe we are blocked for login. I'm not sure. If our login information was different, do you know the reason?
Actually, the day before you joined, can you hear me?
Yes, I can hear you.
The day before you joined, so that day we forgot to try that also. YouTube, we just testing our Zoom account, not YouTube. Maybe that may be the issue. If we
Yeah.
testing,
Maybe
so
we should use the same Zoom. So how can I say, the organizers, the chief engineers Zoom account and YouTube, but the last in the last JIPMA session, I switched to the way using the OBS. Then I capture the Zoom reception image and then transfer to YouTube. Then finally, I could start streaming 3 minutes after the start. I'm sorry for this inconvenient situation. And then I also faced one more problem. Let me share the screen here. Can you see it? Yeah, usually when we have when we do the streaming in medical session, we always check the age restricted. It means the user should be 18 years old, older, over the 18 years old. Yeah, because the many medical session, including the bloody image, and then especially JIPMA session, that's a surgical, a lot of surgical video included in this presentation. Then I totally forgot to turn on this age restricted, and then suddenly YouTube make the JIPMA session video to the age restricted on YouTube site. then the video itself is on YouTube server still, but the user should be over the 18 years old. So maybe next time you may stream out by yourself using your channel. So at the time, please check this setting.
yes, we try that. Or we can use Temtech account, Zoom account.
Yeah,
Okay.
you can. You can. So yeah, sure. So please tell us the situation. You want to use our Zoom account and then YouTube channel, or if you want to use your Zipmas account and then Zipmas YouTube channel. Yeah, let's discuss at the medical working the meeting
Okay.
for next APAN.
Next step. Yeah. We will plan that.
Thank you very much.
Thank you.
Thank you. Any other comments, question? No? Okay, then thank you, Ishak, for supporting the JIPMA session and make presentation.
Thank you.
Okay, then the next is network and technology in dental education and practice, which is also a new session. And chief engineer is Mr. Shudam Datta, but he cannot present. So Shin will make presentation on behalf of Mr. Datta.
Hello, this is Shintaro. Unfortunately, Dr. Data did not provide me with the slides, so I made the slides. And so it's the session review for network and technology in dental education practice. And the session outline, the organizer was Dr. Deborah Sibyl from Jamia Millia Islamia, New Delhi, India. And the connection method was Zoom plus YouTube streaming, and presentation material was ordinary PowerPoint. Connection sites were 7 sites, 3 countries, India, Nepal, and Bangladesh. And as Kuriko mentioned, it was their first time at APAN. And this is their session schedule. It started out with 4 presentations and discussion part 1. Then 4 more presentations and discussion part 2. And I will come back to this later. And they carried out a test before the session, and I joined. And I was concerned because, as you can see, a lot of people connected from their mobile smartphones. So that means that different environment from the actual event. So I was a little worried about that. And this is a session photo, a group photo at the end. And technical review, we had little issues. For example, sharing the PowerPoint material, showing in the slideshow mode. Another issue is not a technical issue, but the session went 35 minutes over. And like I mentioned, there was 8 presentations and 2 discussion parts in 90 minutes. So I think that was a little too much. So this is something the secretariat at Medical Working Group could have advised in advance. And actually we did, but the organizer said she would be on time. So, but this is something we have to discuss in the future. Thank you.
Thank you for your making presentation. Any comments for dental education?
Yeah, thank you so much for great support, Shin-san. So, yeah, there wasn't a little problem because we got proposal from APAN Secretariat really late period. That's why we couldn't do enough support for them. But I really appreciate your technical support for them. Without your help, I think we couldn't achieve it. Just a comment from me. Thank you so much.
Thank you, Komatsu-san.
Not at all.
Thank you. And I saw the session in the middle of the until in the middle, but the session itself was quite interesting, and the theme is remote education for dental category. So I think I thought that we would like to introduce the recorded video for our dentists. So maybe some of our partner, medical working group partner, also very interested in.
Yeah, I think Shin-san, did you get some comment from Dr. Debola that she's gonna attend? She's gonna attend. Not gonna. Does she want to? Did she say she wants to join the APAN54? Did you hear
No,
something?
I haven't got any information about that.
Right, but she did enjoy the APAN, right?
Yeah, I think she really did enjoy it.
Good,
So,
good.
and the session itself was very well organized and a fruitful discussion. So it's a very good topic. So I think if she gives a proposal for APAN54, it's a good topic.
So then I think what we can support them is to introduce dentistry, dentists from Kyushu University Hospital. So I think we introduce them to some dentists in Kyushu University Hospital so that they can make their session more international. So
Yeah,
let's do it.
you.
Yeah,
A
let's
great
do
idea.
it. Let's do it.
Let's do it. Thank you.
Mhm.
Okay, any comments? Okay, so thank you, Shin, for supporting dental education. And next is also Mr. Shintaro is a chief engineer, and session is portable health clinic.
Okay, thank you for a portable PhD session. The organizer was Professor Maruf from Kyushu University Hospital, and I was the chief engineer. And the connection method was Zoom and YouTube. And we used ordinary PowerPoint. And there was 8 sites, 7 countries. That's a lot, I think. Japan, Bangladesh, China, India, Indonesia, Malaysia, and Thailand. And the session schedule was like this: 4 presentations at the beginning and about 20 minutes of group discussion, fruitful discussion. So it was great. And we carried out a test before the session, I think 1 week before. And this is the session photos of today. And it's not much of a technical issue, but over 60 people participated through the Zoom meeting. But since we had the YouTube streaming, maybe we should have circulated the YouTube streaming link. And this is something that would have been fixed if we had more communication between the organizer and the engineer. So that's something we have to work on in the future. That's all.
Thank you very much for your supporting the PhD session. Any comments, question for PhD? No comments. Okay, then the perfect. Thank you.
Always.
Always.
Thank you.
Komatsu-san, why you muted your camera?
When I turn on my camera, I can't, I always have, connection problem. That's why I'm turning.
Oh, I see.
Yeah, I'm sorry for that.
No. Okay, you have network problem. Okay. Then thank you very much for your presentation from all chief engineer. And we would like to have the discussion. So please turn on your camera. And anything is okay for discussion. But I have one thing to discuss with you, which is your engineer experience for training for telemedicine or remote video conferencing in your hospital or your university. So do you have any experience to organize such a training for staff, hospital staff or university staff? So if you have some experience, please, I'd like you to share us. No one have such a experience. So Chian-san, do you have this kind of training for users?
For user or the technician or user?
Technician is also okay. Users or technician.
Okay, well, because in the Taiwan University hospitals, they have a very strong IT engineering. So they hosting the teleconference many times. They all by themselves. So my job recently is I support the medical association. There are many medical associations in Taiwan, and somehow they get to know me and they ask me to support. My aim always try to help them they can in the future they can do it by themselves. So that's my purpose. I always try to teach them. But now, but the problem is for the association, they only very few people work in that association. Even some large one, they may be more personnel, but they told me they rather hire me instead of they doing by themselves. That's makes me very frustrated because I think I like to share the experience, and instead of in the future they can do it by themselves. But now they rather invite me to help them directly. Well, that's I have really no experience to help them to how to train them to do it. But, of course, because they are an association, not in the hospital. Most of the hospital, right now they have engineering. Also, all the technology is improving a lot. So really, people can learn fast. So of course, sometimes I was invited to the hospital, just give them some advice. Even like tomorrow, I was just got informed I will go to Taipei City and help them to do a webinar. The webinar, actually, this is an interesting webinar because it's quite a bigger number. For the registration is over 8,000. 8,000, there's no conference or webinar. Maybe some webinar can do that. So they have to do it the video YouTube streaming, for YouTube streaming. And another challenge for them is they also get the registration from China. And how many? 300 medical doctor or nurse from China, they want to join this symposium, online symposium, but China they don't have this. They cannot use YouTube. I try to connect some China's local provider. A little bit higher the price over the organization is in Taiwan. The price to over their budget. So finally we try to get a Zoom account, which we will mainly support the people from China using the Zoom instead of the YouTube. So, and that's something we need to be aware of. I just heard that also it's good news. Next APAN will be in China. So
yeah.
I'm looking forward we can visit on site. And but just be aware of, because some communication is hard to work in China. So that's my experience so far. Thank you.
Thank you, Chian-san, for sharing your experience. So since I'd like to know the training needs, so I am wondering the NTU staff called Chian-san for what point? So what is the barrier for them, and still they need a Chian-san support?
I think they just people just afraid of maybe made a mistake. People are afraid of making a mistake, so they hope someone with experience and they can support them on site. And I think that's the reason. And of course, we like to share our experience, but I think the experience needs to build up by practice, and that needs to take some effort. So I'm happy right now. Really, a lot of hospitals right now is doing the webinar all by themselves. Even we have at the endoscope session, we used to have a Dr. Xiubo Wang, and he's an endoscope he's a medical doctor. In last year, I supported him few times. Then later, because of all his seminar will every once a month, so very frequently, and many people even from overseas, from China. So I teach them how to do it in a few times, and later he can manage it all by himself. So even have more. So recently he don't bother me. He will do it by himself. So that's good. I think depends on the doctors, whether they are. But I think some doctors, they have confidence to do that, some not. So it's dependent. But anyway, as an engineering, I always willing to support any kind of conference, teleconference. Yeah.
Thank you. I understand. And how about other institutions? I think the NREN supported the streaming for the activity in Nepal. How you support a hospital? Do you have any input for us?
Exactly, we have some project of NodeNet, and then that we have some Zoom servers on premises. So we have some license, then we distribute all the communities, campuses, universities, medical hospitals, and then we support them for how to take class, how to stream their webinars and other. Even we have some webinar license as well. So that operates by and when they are not distributed to others. And we will host a meeting and then assist them for their large conferences and other things. During the COVID period, there are a lot of webinar and meetings have been done, and most of the supports Nirajan help with most people and taking webinars and others. And we provided trainings, in government, non-government, schools, colleges, those who requested us. So that sort of things done by us, and then the traffic has a growth very high as compared to the before because of this streaming and then these meetings.
Oh, thank you very much. You provide your Zoom license and also webinar.
Yes, we have our own premises server, so that is very faster than that other because the server is in our premise, and so meeting data will don't go to the outside of the country. So that's quite better experience.
Thank you. I saw the many on-demand video is listed in the NREN YouTube. Is that done simultaneously library, or you upload the recorded movie later the conference?
Depends on the host what they request. If they want to stream live and they don't have the YouTube accounts and they want to assist, and they just do it for the other people, those who can't attend the meeting or for who want to see the streaming. So they request, then we will do that for them. And if some events that are, then we will do, and that depends on the request of the other parties. What are their policies and other things about the meeting?
Great. Thank you very much for your nice support. So, yeah, any question, comments? Can I ask Sankara Nesralaya team for your supporting your hospital? They I did. Okay. Okay, then any other topic is okay. Any question or rising problem or any topic? This time we have some problem regarding the streaming. So if you have any suggestion or question regarding the streaming, you can write. Or any other topic is okay.
Kriko, may I ask, right now, so far we done all the streaming in this APAN53, and is anyone also, I heard someone also heard someone try to use the Facebook to do the streaming, and do we have any statistics shows how many using the Zoom, because Zoom can also doing the streaming to the different platform. So I think most like for instance, like today's are you using the Zoom to streaming out, or you have used other method? I think using the Zoom. Yeah, using live from the YouTube. So have you tried both to YouTube and Facebook simultaneously?
Oh, maybe another engineer is good for response, but in TEMDEC, we usually use Zoom and Zoom to YouTube, and we don't simultaneously stream to other streamer. And also we sometimes use OBS to YouTube. And but I remember the previous technology session, Satya introduced some service for simultaneously streaming. So any engineer, you can have experience to simultaneously streaming out. Do you have any experience? Maybe not.
I have a comment.
Oh, yeah, please, Min-san.
I think the both Facebook and YouTube provide their own streaming tool, including in the Facebook and YouTube itself. And I think streaming with one PC, so we can easily streaming to both YouTube and Facebook at the same time. So I don't think it's a hard job because I usually do it for my own conference. So, so that's my experience. I think it's very easy. And I see you from Temdeck, you are streaming to YouTube. Is it from the own YouTube function, or you use the third-party software?
We use the Zoom.
Just
and
directly
YouTube.
from Zoom?
Yeah, directly.
Okay, okay. And you can also stream from the live function from YouTube. The Facebook also have the live function. So I think it's we can do it at the same time from one PC. So from that PC, I usually use the one connection to the Zoom and leave it to only for streaming.
Oh, really? Directly, we can do simultaneously to streaming from one PC.
Yes, yes, because both YouTube and Facebook provide the link for streaming.
Mm-hmm. Okay, thank you. We would like to check. Thank you for your input.
Yeah. Okay. I will check again, and maybe I will send you my experience.
Yeah, please share the information through the mailing list.
Okay.
Yeah, it's good to have.
Yeah, and I also want to share one experience about Zoom. I sometimes I use Zoom with the network. I think is a good connection, but sometimes the Zoom show the warning about your bandwidth is not stable or your network is not stable. So yeah, so it's it show the during the meeting. So do you have any experience to turn it off? I don't think my network is not good enough or something the bandwidth is not good, but whole time is the network can use, but several times the Zoom show the warning in front of the meeting screen. Yeah.
Any advice, any experience sharing for this matter? Min-san, your network is not weak enough, not weak, but the announce will be pop up.
Yes, because you know that we do the Zoom everywhere, so the network somewhere may not good enough. But I choose the best for the location. But sometimes the bandwidth is still low, so I don't know how to turn off the warning.
Yeah, when we have the network problem, we usually try to change another network, or we try to mute our camera to reduce the bandwidth.
Yeah. And one more thing. One more thing. I wonder if the Temdeck have the I don't know about the Temdeck Zoom license, but if possible, I may sometime I already asked Sunta for to borrow a Zoom, a room in Zoom, but I don't know about the license from Temdeck because you know sometimes the license is quite expensive for the more than 300 or more than 100 participant Zoom account, and sometimes the hospital or the meeting, they don't need they don't have the many meeting, so sometimes they need the room is only one a month or several 2 or 3 times a month. So is it possible if sometimes the Temdeck can provide a Zoom like a video like you did before?
Okay. If I think we can provide partially host key room, virtual room. Partially is okay. Depend on the request, and it maybe the giving you the whole account may have some issue. So it's up to your request.
Yeah, I think the host key is a good idea.
Host keys is okay. Okay.
Yeah.
Then let's we will discuss and tell you.
Yeah, maybe Temdeck can organize some kind of policy, so that some rule regulation, so we know how to apply to acquire Temdeck's resources for the telemedicine's use. Of course, I mean the way we want to use this, because sometimes for some reason people will hesitate to buy a full license for just 1 day's purpose, and the Zoom and also other platforms, they always request to buy a whole month, at least whole months purchase. So make people hesitate to use that. And in the past 2 years, I'm very lucky. Someone let me use his account for 100 participants' Zoom account, which helped me to save a lot of webinar, which they have no idea how to start with. But my challenge is, once over 100, like 300 something, you have to buy. And our medical profession, of course, you might say the budget should be enough, but for some small associations, small community, their budget is still quite limited. So if that we can share our resources, like before, I remember Temdeck have the DBTS server. That's the only, maybe not only, but a very rare DBTS server we can use. And at that time we can borrow from you. That's really great help. So now even the technology is improving a lot, and but some kinds of the resources still quite limited. Also, maybe if we, for instance, we have a big conference, they call it mega conference, then if we have a 2 account can join together with some computer doing the gateway. So that's also might be worth to consider. I hope that Temdeck, maybe you can have some kind of policy so we know how to apply to get your support. Thank you.
Okay, thank you for your suggestion.
Yeah, and we also need to book a program or schedule to ensure the enough room for the meeting.
Oh yes, yeah, a good platform for apply, so that we will not disturb other issue, other event. So we have a list. Not in Temdeck, I believe in our networking group community. Some of us maybe have some bigger MCU or bigger account. For if possible, we also can share this kind of resources. I remember Bangladesh had some 500 Zoom account. I remember.
I remember.
That's amazing. Yeah. I'm very envy, but we just listen. If possible, in our medical working group, we can have some kind of resource pool. We can to share. So of course, we need a good management. So just make sure everybody have enough resource to you. I always believe there's a word. If we can share enough and care enough, then everybody can have enough.
Okay, thank you for your information.
Yeah. And Kuriko, may I share another thought?
Okay, but the time is limited, so please
Okay,
one
okay,
minute.
just 1 minute.
Okay.
I still although now the Zoom is very easy for engineer to have a meeting. But I think for the new institute or new hospital, the new engineer, they still need support every time. So I still thinking of a kind of, because we have annual meeting, but only 2 times a year. And I know that the TEMDEC have the Facebook page to share information, but I think that page is official. So sometimes it's hard to share the information from our engineer everywhere. So maybe I have an idea to make like a forum or a page, so engineer share the information or technique or their own case anytime.
I see.
So maybe we can discuss about this later.
Okay,
Yeah.
thank you for your suggestion. Communication platform for engineers.
Yes, like a forum.
Yeah, that was I was thinking as well. I'm just a coordinator, but some kind of platform for kind of knowledge base for a special interest group. That's gonna be great. Improvement. For people, especially for engineers, to share their knowledge all the time. Yeah. I really agree with Min-san.
Why don't you use Slack?
Yeah, Slack. Yeah, Slack is
We created the prepared the Slack for the APAN medical working group, but I'm just saying what kind of platform is suitable for this communication?
Yes, I thought it would be Slack, but then yeah, it's gonna be nice to begin with, but it's for archive to work it for archive. I don't think Slack is not suitable, appropriate for archive. So I don't know which service is existing in the world, but it's worth finding some kind of free of charge or cheaper knowledge based service to Slack could be working. So just you can invite all the
and then kind of the platform also
we have ever tried to invite all of them, but it doesn't work. So why?
I want to know what kind of
we should think about that.
Yeah. I think maybe we will discuss later, because we also need the popular platform. We also need the administrator for the
forum. Minson knows we know we strongly recommend Slack, but each has platform they recommend. So
okay, maybe we will find one popular for everyone.
Yeah. So that's a really good idea.
Okay, thank
you. Suggestion. Maybe we have variety of countries, so sometimes very difficult to find a standard or setting policy. But even as you corporate, as you make suggestion as we wanted, I think we could create something for our for all of us. Okay, then thank you for your discussing very long time, and it's time to end the session. But please don't forget, Shunta, prepare virtual reality demonstration after this. So let's take a group photo, and then if you have time, please join the virtual reality demonstration. Shunta send the link in chat room. So first, please let's take the screenshot. So please on your camera, and Tungu, you joined the end of the workshop.
Tungu.
Sorry, I just joined because so many tasks to do in my office.
Oh wow! I want to know what
I know you are the
supported.
famous guy in India, Indonesia, so we know you're quite busy.
So you got yellow t-shirt.
Oh, yellow shirts training. Okay, but
Yellow t-shirt.
okay, then let's take a group photo. Someone can take group photo from Temdek. Okay.
Kuriko-san, I think we need the word from Tomoko Sensei.
Ah, okay. Dr. Tomoki.
Yeah, Moriyama Sensei, please.
Moriyama Sensei, please say.
Need his word.
Yeah.
It's really nice to see your smiling face here. So, and I really appreciate your great effort. It's really successful. It was very fantastic. And as I mentioned in the General Assembly, I suppose we had the largest number of programs in medical working group where I suppose so. Then it's really not probably, but surely due to your great effort and contribution to the APAN medical working group. So, but the past 3 APAN meeting was held totally online. I suppose that most of the people feel a bit sad or not. So I don't think you guys are satisfied. So the next time in 54 in China, we hope to meet in person and had a fruitful discussion, and of course we would like to enjoy drinking, speaking, and chatting or something like that. So I'd like to ask you guys to keep safe and keep healthy, and see you again in China. So see you. Thank you so much.
Thank you. Thank you for your nice comment, and thank you very much for your participant. Let's take a group photo. Peace.
3, 2, 1, smile. Okay, one more. 3, 2, 1, smile. Okay, thank you very much. Then let's go to the virtual